Are amalgam fillings healthy? Should they be removed?
If so, how? Let's find out right now.
Hey, Kenny and Joann here. If you want tips for better health, you're in the right place.
So subscribe and ring the bell like Artie.
Today we're going to talk about our experiences with amalgam fillings, and we're going to also discuss that with Dr. Thomas Lokensgard, our holistic biological dentist.
And his assistant, our dear friend, Joyce Bender.
So let's get started. The Center for Holistic and Biological Dentistry is located in Brentwood, Tennessee, just south of Nashville. It takes about an hour and a half for us to drive up there, but it's worth it for our health. So what are amalgam fillings made of?
Okay. Amalgam fillings are made of 50% mercury, and because they're an amalgamation, they are amalgamated. There's other metals like tin, copper, and some silver in there. But they're 43 to 53% mercury, which the ADA's position is that the mercury is inert. It doesn't vaporize. But we know differently. The IOMT, the IABDM, the Holistic Dental Association all have lots of examples of where they'll take an eraser tip and scratch on the mercury and it vaporizes. So, and it goes right to the brain. And so it's nephrotoxic, it's neurologically toxic, and it hooks up with the ATP molecule, and it displaces the magnesium in the ATP molecule, and so it causes depression, it can cause neurological issues, it can cause fatigue. And that's one of the biggest things it causes is energy fatigue. So it depletes your energy supply.
Do you have amalgam fillings? Let us know in the comments below.
So I was experiencing really weird symptoms. If I ate anything starchy, whether it was an actual starch or not, it could have been an almond flour cupcake or something, it would make me have this uncontrollable gagging. It was like having dry heaves. And my eyes were bloodshot. Every liquid was draining from my eyes and my nose, and it was just horrible. It was a horrible experience, and it would last anywhere from a couple of minutes to 10 minutes of just. It was like I had a huge band of phlegm that couldn't come up, and the only way I could stop it was to make it come up, and the gagging would only stop if I made it come up, so it was horrible. So Joann's really good at making comfort foods in a healthy way. So what she did on my oldest daughter's first wedding anniversary, she remade her wedding cake, and it was a gluten-free vegan carrot cake. And of course it's absolutely delicious, but after I ate that, that's when those symptoms started, where I was gagging uncontrollably. It was horrible. So we just couldn't figure it out. And years went by. I couldn't figure out why this was happening. And I'd read some things about amalgam fillings. So I looked back on that date, and it turns out I'd had a dentist appointment to remove a mercury filling that had been giving me trouble. So when he removed it, he filled it with that composite material that's two-colored and it looks natural. And I like that, so I wanted him to do that. So it turns out he didn't remove it properly, and I ended up having mercury poisoning, and that was one of my symptoms. So I looked up holistic dentist, and I found Dr. Thomas Lokensgard. So we went in January of 2019 and consulted with him, and then made an appointment, came in February of 2019, and he removed all of them, even though there was some on both sides that were remaining. So I followed his detoxification protocol, and within days, those symptoms disappeared. I no longer have that uncontrollable gagging, and it's been great.
Be sure to stick around to the end for bonus tips on healthy implants.
The most important part of removing mercury is first, of course, isolating the tooth so that it doesn't enter your body. So we want you to leave it healthier than what you began. The first thing that'll happen when you come into our office, you'll be taking 4 tablets of charcoal with water so that anything that is in your body will bind to that and it'll flush out. The next thing we do is we isolate the tooth with the rubber dam. And then, of course, we add the oxygen to the patient. They're breathing fresh air. We also have our Mr. Snuffleupagus, but what it is a very big vacuum that gets all the vapors. The vapor is one of the most dangerous part about the mercury. You can swallow a piece of mercury and not affect you as much as the vapors that get in your body and get into your system. So once we have the rubber dam on the tooth, how you do this is the biggest, most important part of doing that. We do not cut the mercury out. The doctor goes around the edge with like this red magic marker, and he cuts a little ditch around it, for such a technical term here, and he takes it out in one piece. So therefore, we're protecting you, the vapors, everything at that point, and we get it out in one piece. And that's the most important part. Most doctors, when they say that they may do everything else, but they want to cut out the mercury, and that's where you've undone all the protection that you were supposed to have. So it's very important that your doctor cuts around the mercury piece and takes it out whole and not touch it.
If you like this video, please give it a thumbs up.
It'll really help us out.
You asked about the meridian connection. So the teeth, there's a very famous physician out there who says that 80% of disease states are caused in the mouth, or start in the mouth. So there's a connection between the organ systems and the teeth, which are like little circuit breakers, to the meridians, to the traditional Chinese meridians, and so they're all connected. Each tooth is connected to an organ or an organ system, or a joint, or some kind of glandular tissue. And so what's happening in the mouth, infections, root canals, osteocavitations can directly affect organ systems. And I'll give you the best example I can give you is breast cancer and failed root canals. Thomas Rau, who's an MD, did a study in Switzerland. He has an oncology clinic. He did a study on women's breast cancer. Thomas Rau made the connection between failed root canals in the first molar position and breast cancer on the ipsilateral, which means the same side. He found a 97% correlation, which is huge. So what we say to our patients is if you have failed root canals, get them out of your head, because they're not doing you any good. They're infections that go systemically into the cardiovascular system. There's another famous physician named Thomas Levy who says that a lot of the root canals are causative, and a lot of periodontal infections are causative for cardiovascular disease.
Be sure and look in the description below for all the resources we mentioned in this video.
Before I made a connection, I had been having bad gallbladder issues and stomach and digestive issues, and I was attributing it to my gastric bypass surgery, thinking I possibly just ate something wrong, got the wrong spice, whatever, and I was trying to figure out what could be causing this. And it happened at least twice a year, usually about every 6 months. I went ahead and had a cleaning while Kenny was doing his filling removal and replacement, and as it turns out, I had another attack shortly after just the simple cleaning. And I started thinking about it, and when we consulted with Dr. Tom about everything, he gave me a regimen as to which order of importance I need to have my teeth replaced, and the fillings replaced, and bridges and such as that. I had a very bad childhood dentist, and so I had a whole mouthful of issues going on, and so I was going to be an extended visit for sure. We made the appointment to go back and start with the first tooth that was the worst, and it turned out to be the very back molar on the bottom. And he started removing the filling, and he was going to refill it. It was a really large filling, and he said the tooth is just too far gone. It needs to really come out. I can't really do much more to save it. So I said, okay. So we went ahead and had the tooth removed, and I still was not totally convinced of everything, but it all made sense, but I wasn't totally convinced. So I jokingly said, well, maybe I won't have any more episodes then. And Dr. Tom whipped around and he said, episode? What episode? And I explained to him, and he says, come here and look at this. And he showed me a chart on the wall, how that particular area is connected through the spinal column to the digestive and gallbladder area. And I said, okay. So I had the tooth removed, and that was about 2.5 years ago. And I have not had one single episode since. I have had cleanings every 6 months. I have not had one single episode. So I was having, every time I went to have my teeth cleaned, with the number of fillings I had, they were stirring up the mercury, and I was inhaling it, and like Joyce had said, the vapors in the are worse than actually swallowing a piece of mercury. So I was getting all that vapor and dust and everything in my system, causing me to have the issue. So at that point I said, just do it all. Just do it all. I'm done. I'm completely convinced. And also, another thing that it really helped me, I have noticed big differences. I have less fatigue. I have more energy. I have more clarity, and that all is connected to mercury poisoning from your amalgam fillings. So I am now, my mouth is completely good, and I have been in better health than I have ever been in my life. So I'm completely convinced.
Be sure and look in the description below for Green Smoothie Girl's Healthy Mouth, Healthy Life course.
So what happens when you have a root canal? Mine was 35 years old when we took this x-ray. It was from a car accident. So we took an x-ray, and your teeth have a lot of tubules that where infection can just stay. And it never really quite goes away, but it may not ever bother you. It didn't hurt. Mine never hurt. So because I didn't want having a root canal here, I had it removed and had an implant put in the same day. As soon as it was placed, that infection grew real quick, because once air hits it, it just expands. And so this is what infection does. It eats the bone away and leaves a big hole there. So you have to treat it. We treated it with ozone, and unfortunately we had to use antibiotics as well. But ozone is what helped get it calmed down. So we had an all-porcelain implant put in, and a year later, I've got a perfectly nice-looking tooth there, and no one knows that I have an implant because I have an all-porcelain. We prefer an all-porcelain versus a titanium. There is some studies showing that titanium does, for lack of a better word, rust over time. So it leaks some. Porcelain does not. It infuses to the bone a little bit better.
So is your implant, is the infection part now completely gone?
Completely gone. Mm-hmm.
Okay.
So it's healed up. But that tells you how it took me 1.5 years to get it completely cleared up, because it had been sitting there for so long, and once air hits it, it just went crazy.
You ask if mercury is connected to cancer, and the answer is absolutely yes, because mercury is so neurotoxic, renal toxic. It affects the gut. It can cause cancer of the intestines and of the gut, and the connection is huge, and that's why we remove mercury fillings, like Joyce showed you how to do.
How do we do an implant? We refer to Dr. William Lokensgard. He's here in Brentwood, and he's known all over the world. He teaches all over, and he's just, I think, one of the best doctors out there doing this. He's only one in this area that does all porcelain or zirconium implants. With him and with my tooth, we took out the tooth. He cleans out the periodontal ligament, and then he does PRP. He draws your blood before he gets started, spins it down, and takes that little blood clot and packs it once he puts the implant in. That makes it stem cell, and that's what makes it heal. He has titanium, and he has the all porcelain. And like I had said earlier, porcelain is our preference. Every once in a while you may not have enough bone and you have to do a titanium, but porcelain is always recommended more.
Is zirconium okay for if you don't have any bone?
It's such a individual thing, like no shoe fits the same. Same thing with implants. It all depends how much bone you have there, and it's the thickness and width of the amount of bone you have, not how deep it is, but the width of it. So usually they take a CBCT scan to make sure that there's plenty of bone there before they ever do it.
We have other videos about detoxifying heavy metals from your body, so watch these next.
Thanks for watching. Bye-bye.